after we do our physical therapy and rehab assessment, if we could nail down and determine that that knee has a directional preference, which, like I said, for a lot of this anterior knee pain, it's typically going to be extension. Then I like to basically do stuff that's really driving that knee into what we establish the directional preference to be. So doing a lot of the kind of like the trigger points that you discussed, like working right into like the base of the quads, hitting up even sometimes up into like the rectus femoris. I like to really dig, even though the pain's on the front. I like to go after like the back of the knee too, and actually get some like release on popliteus, the hamstring tendons, the top of the calves, and everything. And it's really nice as well too, even though it seems wild to think about this because you can't really go deep into the joint, but it's actually wild the amount that we could do if we just take our thumbs and work through the joint line, how much pain and how much mobility that seems to put right back into the knee, and pain that it seems to melt away. And then our favorite types of adjustments, typically, if it's going to be an extension responder for this anterior knee pain, the total knee extensions. So really kind of driving that knee deep into there, so that way you have that flexibility, that functional range back, and it's incredible how much that sort of shuts down the adaptive muscle patterns, and at least shows you how you could function the way that you're supposed to. So that way, in time, as these exercises start to take hold, and we're able to turn back on that healthy, productive pattern with our treatments in office, eventually we take advantage of that neuroplasticity and actually get things to stick over time as well too. Couldn't agree more so with you though. Any sort of lower extremity pain, like the strengthening phase of treatment, is going to be absolutely imperative. Like
Mm-hmm.
we need to work on things like the one-legged balance stability to bring glute medius and ankle stability back up to speed. If we're finding that somebody just has a really overactive calf, then we might even go down and say, like, this is how you actually need to stretch your calf. But
Mm-hmm.
in reality, it's going to be a handful of things that have to be worked on. But it really doesn't take too much of modifying and cleaning up small little things to make a massive difference. I
Definitely.